Welcome! I'm Jessie Cooper. This is our limited series, which is Q&A at IABA. We are answering commonly asked questions from our parents, consumers, people who are interested in learning more about autism and applied behavior analysis. So let's jump in. What are we going to talk about this week? Well, piggybacking on last week, we're going to talk about what is ABA? So, what I like to tell everybody when we're talking about ABA is the scientific sister of psychology. What do I mean by that? In psychology, clinical psychology, the way that they find treatment for the population that they're serving is through indirect studies, studying thousands and thousands and thousands of patients who have been in similar studies, comparing outcomes and saying, based off of this population, treatments that we've tried, we believe this to be the best care. Say we're dealing with anxiety, we studied thousands of people with anxiety. We've researched them, we've interviewed them, we've compiled that information and said, we think this is the best treatment. Nothing wrong with that. It's a way to treat mental health services on the clinical psychology side. On the ABA side, where we're the scientific sister, what we're doing is looking at single subject design instead of massive interviews, massive data, massive collection of information surrounding a diagnosis. What does that look like? What that looks like in applied behavior analysis and the research that eventually produces the treatment that your child or loved one will receive is when we're studying a population, let's say autism, since that's what we're working on here, and we say, okay, we're treating these individuals who are autistic. They have these series of behaviors that need intervention and help. And so in applied behavior analysis, what our researchers do is study one client at a time, one participant at a time with similar behaviors and say, okay, related to the autism diagnoses, what do we need to increase to add social validity and quality of life? And what do we need to decrease? Whether we're increasing or decreasing a behavior in our study and our science, we're looking at a dependent variable. We're saying this is what we're looking to treat. And then we create an intervention. And that intervention is always environmentally based. We call that our independent variable. And when we use an independent variable against the dependent variable and see either the increase of the skills that we're wanting to see or the decrease of skills that we're wanting to see, and able to replicate that across hundreds, thousands of participants in the same or similar population from the data, one client at a time compared against another client and another client, and we're able to see outcome, positive outcome for that population. Based on our data, we're able to say we have evidence-based care. And so in mainstream psychology, our non-scientific sister, brother, what they're looking at is within a major population through research, what could be best outcome based off of indirect methods. Nothing, again, wrong with that. It's just a different way to approach mental health services. In applied behavior analysis, we are looking at directly intervening one client participant at a time, studying that intervention and replicating it across similar populations. And when we're able to see success across that population, we're able to say we have evidence-based care. What does this mean for your loved one? What this means for your loved one, say we're on the autism route here and they come into applied behavior analysis as therapy, what you're receiving is individualized treatment based upon thousands and thousands and thousands of studies of children and participants who are similar to your child, who have had a similar intervention and success. What it also means is when your client or your child walks through the door, while we're taking that body of research and saying this is what worked best for the population, we are studying, working with, and creating an intervention individually for your child based on the research. Interventions are always done with individualized assessments, individualized instructional design, analyzing our data to make sure that your child's skills that need to be increased are increasing, behaviors that are impeding their ability to learn, to be safe, to interact with others are decreasing, And all of this is done through data, analysis, and science. What skills are we trying to increase and decrease? In applied behavior analysis, the answer always rests in social validity. Is the behavior I'm increasing adding quality of life and decreasing adding quality of life? If the answer is yes, we're going to provide an intervention. Common areas we program in: language, socialization, teaching tool skills to be able to interact in a social world, which can be academic in nature, leading to same age peer interactions, developmental milestones, and also on the other side, decreasing behaviors that are creating safety issues, socialization issues, and where our client or your child is really saying, I'm missing some skills here, and so I'm using these behaviors in order to get my needs met. In ABA, we're able to pinpoint those behaviors, create an intervention to decrease behaviors that are not working, that are not safe, and to increase skills to help them navigate a social world through this individualized treatment plan. I hope this helps in explaining the big world of ABA. Again, in a nutshell, single subject design, social validity, evidence-based care. Thank you so much for joining me for Q&A, and I hope to see you next time.